I am a cancer psychologist here with the James and an assistant professor with OSU, and I'm going to be talking a little bit tonight about caring for caregivers and talking about some tips for managing stress. So I wanted to start off with just talking about the objectives and the things that I'm going to focus on tonight. First, just defining what a caregiver is, talking a little bit about what stress is, how we assess caregiver burden and stress, discussing some skills for stress reduction, and then reviewing some specific approaches that seem to be helpful in managing stress. And some of those are going to be stress management things that can be applied more broadly, but specifically for caregiver stress. So as we know, anybody who's been a caregiver before, a caregiver has many roles and many hats. So a caregiver works with the healthcare team, has an important role in improving the patient's health and quality of life. Caregivers can really be anyone. Could be a spouse, a partner, a child, a relative, a friend. Could be somebody that you work with in the hospital, a staff member. And roles really may differ depending on, this is obviously specific to cancer patients and their caregivers. And a lot of times those roles differ depending on the stage of survivorship, so where your loved one is in the process. So, if it's early diagnosis, the role might be much more focused on helping the patient learn the medical system or gather information or just sort of navigate this whole new, overwhelming world. If the patient is more in a treatment phase, it might be coordinating appointments, schedules, figuring out insurance, being sort of the in-between person, talking to the medical team, also trying to maintain just life in general, household tasks, finances. Caregivers also provide emotional and spiritual support, help with decision-making, monitor changes in health or just changes in the patient in general. And, I think it's also really important to remember that caregivers are in multiple roles and are juggling all this, which is where I think stress tends to come in when you are caregiving, but also sort of managing. Life doesn't stop when you're a caregiver, so you have to keep juggling all these balls in the air, which can become really stressful really quickly. So there are a few different definitions of stress. I think we all kind of define stress differently. One definition is that stress arises when individuals perceive that they cannot adequately cope with the demands being made on them or with threats to their well-being. Stress is often described as a feeling of being overwhelmed, worried, run down. It can affect pretty much anyone and everyone. No one is immune to stress. And, by definition, stress is any uncomfortable emotional experience accompanied by predictable biochemical, physiological, and behavioral changes. That's kind of a mouthful. When I think about more of the biochemical or physiological response, I think a little bit about, when I'm stressed out, what is my body doing? That's sort of the physiological biochemical process. So, if you've ever been stuck in traffic, you're driving on the highway and the person in front of you slams on their brakes, and then all of a sudden you have to slam on your brakes, and you have this surge of oh my goodness, I have to act right now. That's sort of our fight or flight response kicking in, which is a very evolutionarily designed process that kicks in whenever there's a threat or whenever there is danger. So our bodies really amp up to fight off the threat, stop the threat, or get out, which is why we have fight or flight. The thing we know about stress is that stress activates that same system. So when we are chronically stressed out, whether that's because you're caregiving or whatever, job stress, whatever the case may be, that fight or flight mode is sort of on halfway. And that's a lot of wear and tear on our bodies, which can make us really run down. I mean, that's why we end up, with headaches when we're stressed out or really tired or just feeling like we're carrying all of this tension in our bodies. Stress can really have an impact on us physiologically. So that's kind of the take-home point of that last blurb there. We tend to talk about stress kind of, I guess, colloquially, that stress is bad. When you hear stress, you think negative, bad things. But not all stress is necessarily bad. So we do need some stress to be able to operate. And we have this model, this Yerkes-Dodson model, that sort of illustrates arousal is on the bottom, which is, you could consider arousal stress, and our performance. So there's this connection between how stressed we are and how well we are doing or how well we are performing. And there's a little bit of a sweet spot, which is where you see this curve at the very top is the sweet spot where you have just the right amount of stress that makes you perform well. If your stress is too low, your performance isn't going to be great. If your stress is way too high, it's not going to be great. So I think this applies a lot to like athletes, right? So if you are playing in that big OSU football game and you've got 10 seconds to tie the game as the quarterback, you are going to have some stress, but you need some of that stress to be able to perform. That's going to make you focus. It's going to make you pay attention, be motivated. You need that stress. But too much stress may make you fumble the ball, or not enough stress may make you feel like, oh, well, it's not a big deal. It doesn't really matter if we win the game or not. So the ideal amount of stress is important. So this kind of highlights that not all stress is bad. So I think about, somebody coming into an ER, right? Or some natural disaster happens and the ER gets flooded. The staff are going to be stressed out, right? But they probably need a little bit of a surge of stress to get organized, get triage, figure out who needs what, get going, get motivated. Too much stress could cause chaos. Not enough stress is probably not going to get people help, get people motivated. So again, just a couple examples that remind us that not necessarily all stress is bad. We want to have that like sweet spot, basically. If there are questions about that, I'm happy to talk more about that, definitely at the end. I know it can be kind of confusing, but not all stress is bad is the take-home point, but we want to manage it so it's not too high, and we also don't want it too low. So caregiver burden is defined by the extent to which caregivers perceive that caregiving has had an adverse effect on their emotional, social, financial, physical, or spiritual well-being. And this is very individualized. So everybody kind of experiences their stress differently, depends on the person. And it's very multi-dimensional, which means it's complex. So it may be dependent on other things that are going on. Maybe that's job stress in addition, or having multiple caregiving roles. It really depends. It has lots of different dimensions. And we also know that caregiver burden can occur with staff working in hospitals. They could be caring not necessarily only for cancer patients, families, friends, but we see a lot of caregiver burden in the cancer population, and also like stroke and dementia and Alzheimer's, where there's long-term caregiving going on that can become very stressful very quickly. So assessment of caregiver burden. So this is something that I do a lot in my job when I encounter patients and their families and their caregivers, is trying to really hone in on who the caregiver is and ask them a few questions about how they're doing, because I think sometimes it's pretty easy to get very patient focused, and as we should be, but we should also be caregiver focused as well. So, it's important to figure out who the caregivers are, identify them, make sure, I always make sure to ask, like, is there anybody involved in your care who's not present here today? Anybody that we're missing, just so I know who's involved. And making sure that we incorporate the needs and preferences of both the patient and the caregiver in planning. So, a really simple example might be, I might see a patient in therapy and we may be scheduling an appointment. If I don't take into account that the patient's wife is providing the transportation, I'm gonna have a fail here. Like, I need to incorporate the caregiver in my plans because they're an important part of what's happening and an important part of the care. That's just a trivial example, but an important one. It's also, I think, important to make sure that we check in with caregivers' understanding of kind of what their role is, what's expected of them. Do they need anything to carry out their tasks? You know, if you're sending, a patient home with a whole multitude of medications and the caregiver is sort of in charge of making sure that all these medications are given at a certain time and adequately, like, does the caregiver have all the information they need? If they have a question, do they have the number they can call? Really checking in and making sure that they have what they need to do their job. That helps decrease stress a little bit, not a ton, but every little bit counts. And also just recognizing the need that just one check-in isn't enough, that we should be consistently checking in with caregivers and, along the trajectory just to make sure that they're doing okay, or checking in to see if they need something different or if needs have changed. A lot of times I like to ask, caregivers also, like, when's the last time you saw your doctor? When's the last time, you checked in about taking care of yourself? Because I think caregivers put their health often to the side very quickly, and it's important that caregivers stay healthy themselves. I also like to check in about, like, quality of life. Who are your supports? What are you doing for fun? Which is usually the answer, like, not very much, but, at least it's maybe a little reminder that if you can snag 5 minutes just for yourself, that's an important 5 minutes. So in addition to some of those approaches, it's important to make sure that we are exploring the caregiver's sense of well-being and confidence in their ability to provide care, making sure that, do you need additional support? What do you need to feel like you can do your job well and care for your loved one to the best of your ability? Because caregiving is an important job and a valued one. So there are some different risk factors that are associated with caregiver burden. I think a lot of these probably make a lot of sense as to why they are risk factors. So, for example, being female. I think in our societal roles sort of dictate women as natural caregivers, and so sometimes it seems like it's the case that maybe some of the caregiver burden falls on women more generally. That not to say that men don't suffer from caregiver burden at all, but sometimes gender or sex can be a risk factor. Low educational attainment, residing with the care recipient, which is an interesting one because I think a lot of caregivers are living with the person that they're caring for, but you can see how that's a risk factor. If you're just a friend who stops by, provides meals, cuts the grass, comes over to provide some emotional support, but you get to go home, you get a break. So if you're living with the person, that's sort of a constant stressor, I guess, in some ways. So I think that's probably why that's a risk factor. Depression or any kind of like mental health concerns that are pre-existing obviously can put you at risk. If you're socially isolated, don't have a lot of your own support, financial stress, which that's hard to not come by, it seems like, especially when cancer is part of the picture. High number of hours spent caregiving and lack of choice in being a caregiver are all some risk factors. Some of the signs of caregiver stress, so when these are maybe some signs that, I feel like probably a lot of people who are caregiving are experiencing these things, but maybe just if some of these things are happening or a lot of these things are happening, it might just be a trigger to reset a little bit and say, okay, I maybe need to find a little time for myself because I am really struggling here. Physical exhaustion. I feel like caregivers often say, like, I am just exhausted. Like, I have nothing left to give. I'm just totally depleted, totally drained. A lot of people report guilt, like when I take time for myself, or like I decided to go out for one night with my friends and the whole time I just felt awful because I felt like I should have been home or I should have been doing something else. Starting to feel resentment or feeling like you're getting critical or irritable or short, feeling trapped, not sleeping, not exercising, sort of putting to the wayside all the things that you would normally be doing. Now I know that's kind of a double-edged sword because when you're caregiving, time gets really limited really quickly, so you may not have all the time that you want to, do your 7-mile run or, go to the movies every weekend or whatever you do for fun. But when all of that stuff starts to fall to the wayside, that can be a sign of increasing stress, feeling like you're unappreciated and feeling like your mood's not in a great place, or feeling more worried or anxious or just apprehensive, all signs of increasing caregiver stress. So maybe if some of these things, all of these things, a bunch of these things are all happening at once, that can be kind of a red flag that, okay, I need to kind of figure out what I need to do to get some of this stuff evened out, which I'm going to talk about, lots of ways that you can try to do that. So how do we address caregiver stress? What are some of the things that you can do? So some of the basics are, I think we hear and we tell people self-care all the time. Really, what does that mean? How many of us actually take the time to do self-care? I have to practice what I preach, of course, but seeking support, using your supports, that's what they're there for, really honing in on, maybe it's clergy, maybe it's a professional, a neighbor, friends, whoever the case may be. Participate. Know that your role in the medical team is super, super important. So don't be afraid to be an active participant. Absorb as much information as you can, and try to get some respite. Try to get some break somewhere. And I'm going to talk a little bit about that. Can be 2 minutes, that can be a weekend vacation. It doesn't necessarily have to be long or a lot or anything extreme, but just find some way to get a mental, physical break from your duties, and allow others to help to allow you to get that break.